Hi, I'm Avi Ratnanesan. I'm the founder and CEO of Energesse, and we're basically a data analytics and advisory firm that helps organizations with staff shortages, risk management, as well as the patient experience. A lot of our work over the last 10 years has been across 5 countries, including Australia, UK, US, as well as countries in Asia. And particularly the focus of late has been around addressing workforce shortages, workforce strategy, and also enabling staff retention, particularly in the nursing area, which is one of the most acute areas of the workforce at the moment. Part of my experience has been quite varied across the health sector. So I started off my career as a doctor in the NHS and worked in the health system over there, and really had a lot of frontline experience across medical wards, surgical wards, and so on, to understand what it's like to work in that environment. I also worked in the health system in Australia across public and private hospitals, which again exposed me to some different environments of nursing. Subsequently to that, I also had experience in the biotech and pharmaceutical industry, which gave me a very clear sense about how medications are developed and how they're prescribed and used on the wards, as well as experience now with over 100 different organizations across the health sector in 5 countries, from health insurers to research institutions and so on. So when we look at problems, we tend to look at it from a systems thinking perspective, from a multifactorial view, because complex problems like the nursing shortages don't just have one root cause. There are often multiple root causes, and unless we understand what they all are and how we actually shift these levers and drivers, it's very difficult to solve them. So if we look at the problem and we try and understand it from a cost perspective, which is one perspective, then that actually unveils some of the root causes here. Now, we know that there's a global problem in a shortage of nurses. We know that there's about 5 million, we're about 5 million nurses short of what we need globally. We know that throughout recent times, the International Council of Nursing mentioned that there's about a 4% increase in that shortage, or a reduction in that capacity from nurses. And so the problem's actually getting worse. And we also know that this is a long-term issue that over the next decades will continue to be an acute problem. If anything, the pandemic made it worse. And one of the big reasons the pandemic made it worse was because many nurses fell ill throughout the pandemic as a result of COVID. But not only that, it was the impact of the workload. Many people on the front line were working 7 days a week to help their populations, their patients, and care for them throughout this very, very difficult period, resulting in very significant burnout, fatigue, and so on. You combine all those factors together, and you've got basically almost a perfect storm occurring, where these shortages are not something that can be dealt with really easily with short-term fixes. And so we really need to understand how this acute shortage is impacting different countries and different areas as well. And we'll talk a bit about this in some of the questions. But one of the things that's key is to understand these costs, because if we look at the health system as a whole, we also have to recognize, ironically or not, and this is something I learned after many years in management, and not being on the front line, but in management of healthcare and advising CEOs, CFOs, that's chief financial officers, directors of nursing, directors of medical services, and so on, is that we do have to understand the financials of the system in order to shift the system. And when we understand the cost of turnover, some studies have shown that it can cost an organization about $48,000 US every time a nurse leaves the organization. Now, that's a huge cost. So if we really understood that, and we really understood that the cost of turnover of a nurse can include the recruitment fees, the agency fees to replace a staff, the cost of onboarding a new staff member, the loss of productivity of a new staff member leaving, the loss of productivity of a disengaged staff member being on hand. All these factors means you're not getting the best out of your people, and there's a huge cost to that. Now, what if we understood those costs at an organizational level and reinvested that on strategies that improve well-being, on strategies that improve engagement, on strategies that actually included some aspect of pay rises where appropriate? this could actually change the equation. But we don't often do that. And so part of what we need to do in terms of looking at the problem is to understand the underlying factors behind the shortages, because they are slightly, whilst the big macro factors around these global nursing shortages, there are some specific factors in each organization, department, and team that can make the challenge of nurse turnover or nurse shortages even worse. And so we have to understand that in order to solve it. So in terms of the areas of nursing that seem to be most in demand that we've observed, well, firstly, we all know that almost all areas are impacted, but some worse than others. Critical care, intensive care, and so on are very acutely short, and that has been the case, particularly during the acute phase of the pandemic, where we were dealing with a lot of patients in critical care. Fortunately, as a result of programs such as vaccinations, such as telehealth, and also helping to build the immunity of communities through better health and well-being programs, we've seen that that problem be alleviated slightly in countries such as Australia, where we're starting to come out of it, although it is still an acute problem in that intensive care space. Community care also seems to be an area that is acutely short, and this is when we deliver care out to people in their homes. And finally, also an area that is acutely short is these hospitals and aged care or residential care services in remote communities. So attracting nursing, particularly to those rural and remote communities, is also a problem. Now, one of the ways that we are trying to address that sometimes is by recruiting nurses from developing countries into developed countries. But what can happen then is then you cause a bigger problem in some of these developing countries instead of trying to find an equitable way to solve the problem. So the International Council of Nursing is looking at how we can do this in a better way, such as in how we deal with climate change, a more collaborative multi-country approach. Having said that, each organization, as I mentioned, needs to think of its own strategies to solve these challenges. So in terms of the specific areas of nursing that are struggling, well, one of the big areas, when I talk to these CFOs, directors of nursing and so on, the big challenge I hear is, the inability to find staff, the inability to find and recruit the appropriate nursing staff and experienced nursing staff, particularly in areas such as aged care and certain areas of hospital care as well. When you actually dig deeper, you find that one of the big issues is the inability to gain investment into those areas of nursing that need it. And sometimes that challenge is a challenge of the conversation between the nurse leader, the finance leader, the CFO, and so on. They're often coming at the problem at different levels. So, and often the rhetoric is, we want more pay. But often, in order to get more investment, you have to develop an appropriate business case. You have to actually show what is the return on that investment. And whilst it's very human of all of us to want our nurses to be paid better, the reality is we live, as I mentioned, in that sort of management and financial world where resources are constrained in many areas. And unless we are able to communicate that specific business case, unless we're able to show that return on investment, it's difficult to actually resource some of these areas appropriately. I mentioned the cost of turnover earlier, but it's also about looking at, well, if we want to look at the pay rises, then what's an appropriate pay rise that offsets the turnover costs? That's one way to look at things. And senior management have to have these conversations in a very competent way. Another area is middle management, and middle management are often struggling in terms of trying to manage the expectations of their CEOs and directors of nursing and so on with multiplicity of guidelines, and particularly in the era of the pandemic, lots and lots of new guidelines being introduced. How do you expect anyone to keep up? It's virtually humanly impossible. And with all the policies that are changing all the time, and at the same time, middle management also have to cope with a lot of the frontliners and their expectations and filling those roles. There's really not a lot of time to be strategic. At the end of the day, middle management also have to have good people management skills, and often they rise up through being good technical leaders and good technical nurses, but being that strong people manager is something that also requires some training. So that's also an area to develop, because in doing so, you actually build your leadership, you build your career development pathway, and often you understand how to manage people better in order to keep them in your organization. Obviously, the challenge for frontliners, that's no surprise to everyone. So many frontliners are burnt out. I think patient expectations, whilst they were rising before the pandemic, I think probably patients have become, in some areas, a little bit more patient with the system and with the frontline, but in other areas very much more frustrated because of the mental health impact of lockdowns, of restrictions, and so on. I'm certainly hearing that in many areas that this increase in violent episodes at the frontline, which shouldn't be tolerated at all, but the reality is they do happen because people are coming in with so much frustration sometimes into the health system as a result of COVID that the frontliners are taking the burden of that. So these are some of the things that we need to be conscious of in how we sort of help leaders through these challenges. So in terms of the areas that excite me from a technology perspective, I'm really excited about, firstly, let's just acknowledge that there are a plethora of technologies in healthcare, in medtech, in terms of diagnostics, devices, in terms of new therapies, bionics, robotics, and so on. I just delivered a lecture which included virtual reality, augmented reality, and there's a plethora of these technologies coming through that are really, really exciting. What I'm excited about most of all is when they actually make a significant difference in terms of the patient's experience, their clinical outcomes. It improves the experience of the workforce and can also show a better return on investment financially. So this is called the healthcare quadruple aims, and many people have heard of the quadruple aims. But I think we can't just introduce technology for technology's sake. We have to look at all these different areas and whether technology satisfies all these different outcomes. Big data and algorithms is an area that we're involved in. So we're actually helping organizations to actually understand the root causes of turnover, correlations between well-being, the shortages, and then how to drive retention. But also big data and the use of algorithms is going to support a lot of decision making over the next 5 to 10 years. And I'm really excited about that because if we can make better decisions along the way and not be in panic and reactive mode all the time, we will have a much better health system and we will run our organizations much more effectively, particularly in dealing with some of these shortages. I'm really excited about apps that also enable better well-being, I think, and not just for patients and consumers, but also for staff. So apps around mindfulness and well-being and so on. We know that these are key skills that are going to help us on a day-to-day basis, which are going to be absolutely fantastic. Super excited about the virtual reality tools that are out there at the moment, because not only do they help staff train themselves in a more virtual environment, so the ability to often simulate surgeries or caring for patients with dementia using these virtual reality goggles is pretty exciting. But one of the things that is also really important is actually looking at how that's applied in the context of telehealth. And that is when we can care for these patients in their homes and the patients themselves being able to use these virtual reality goggles to self-care for themselves in some areas, but also where we can deliver that care on the laptops so patients can receive the care from their homes as well. I think that's going to offload a lot of the burden on hospitals, which is where a significant amount of burden is for nursing staff as well. So I think these are, I could go on and on with technology and innovation, but I think one of the things I think that's most necessary is, again, it satisfies, improves patient experience. 2, the clinical outcomes. 3, it must show value and improvement on a return on investment or value. And 4, it also improves the staff experience of care as well. A lot of organizations are also saying, please automate the functions of nurses as much as possible because of these labor shortages. So I think that's going to be a big area where we can automate the work of nurses is going to be a big area moving forward as well. So in terms of whether nurses look after their well-being, I think this is, again, we've got to think about it from multiple levels. So the level of the individual, the level of the team and organization, and the level of the system. Fundamentally, I believe that everyone's health is their own responsibility first and foremost. We talk about patient self-empowerment, and me being a doctor as a background as well, you want to deliver the best care you can, but ultimately a patient is responsible for their own health and well-being. The same is true if we're talking about any clinician or any nurse. We are responsible for our own health and well-being first and foremost. So I think it would be remiss of me or anyone to say that the nurses do take care of themselves or don't take care of themselves, because it's a personal and individual choice and behavior pattern. So one of the things I think that is really important is for nurses to think about the choices that you make when working. Obviously, it's about, part of this is about your work environment and your work responsibilities. Part of it is about your home life and everything in between. When we think about well-being, there are many aspects to that. There's spiritual health, mental health, emotional health, environment health, career, finance, and so on. So there's many dimensions to being a holistic person with holistic well-being. But it's important to think about the choices that you make, particularly when you're at work and at the workplace, are really important. What is the food that you're eating whilst you're working? Is it healthy? How much movement are you getting? In some areas of nursing, there may be significant movement and significant strain. In other areas, we may be sitting way too long in front of a computer. And so that sitting is the new smoking, as they say. It is a risk factor for heart disease if we sit too long. I have this challenge myself. And so it's really important that whatever roles we are, we balance them out. If we're getting too much physical strain, we need to find more periods of rest. If we're sitting down too much, we need to get up and move more. So how the individual adapts to this is really important. I remember when I was working on the wards and going from floor to floor, I barely had a waistline. I was always moving because I was this junior doctor treating patients on different wards. As soon as I moved to an office-based role, my belly started to bulge and that activity all disappeared. So one of the things that we've learned from areas like the blue zones, and blue zones are countries around the world where there's a higher per capita of population living over the age of 100, such as Sardinia in Italy, Okinawa in Japan, and so on. These people integrate sort of movement and physical activity into their day-to-day activity. So they don't separate it from I'm going to work now and then I'm going to go to the gym or do my exercise later. They actually integrate all that into their work life. And that's one of the things that I think is really important and for nurses to be aware of. Some simple things that nurses can do to look after their well-being includes things like, when you're doing a huddle, stand up, do a stand-up huddle. At least then you're standing up for some periods. If you're having to do a meeting, do walking meetings. So walk and talk as you're doing the meeting so that you integrate some movement. And again, be more conscious about the choices of food that you're having. So instead of, typically you might have a lot of cake and biscuits and so on, maybe balance that out with some greens or carrots and hummus or some healthier choices as well. This might seem a little bit weird to begin with, but if at the end of the day, we have to look after each other and our own health. And so, helping make these better choices is going to be really important in the long term for nurses to look after their own well-being first. The other parts to this question is just around thinking about teams and organizations. I do think there's a significant underinvestment of organizations into the well-being of staff in healthcare. In fact, I was quite surprised by that, considering we are supposed to be the more caring and health conscious sort of industry, but I don't think we put as much into the well-being of our staff as we can. And so one of the things I think is more investment into the space, but also programs that actually appeal to nurses and to other clinical and medical staff and are contextually appropriate. We can do the gym, we can do the yoga, we can do the mindfulness, they're all appropriate, but we do have to cater to the demographics of our staff with these programs. And we should try and look at how can we measure the effectiveness of these programs as well, and not just put them in there as tokenistic tick box efforts, but actually measure the progress of that as well. Years, let's call it. However, what's coming now is this whole mental health epidemic, the burnout, the fatigue, irrespective of what other viral strains may come through. And we may well see, and we're predicting that impact to significantly change the dynamics of nursing and potentially make that even worse as people leave the profession, retire early. There's, a lot of literature around the Great Resignation, the Great Retirement, and so on. I feel that will continue. And fundamentally, some people in the nursing profession, as well as in other industries, have made completely different life choices and have actually said, I'm not going to work as hard anymore. I'm not going to work in these permanent roles. I'm going to go agency or casual or locum and work part-time simply for a better work-life balance. Now, what does that mean? That means that there's that gap may well increase. So whilst people are remaining in the workforce, there may be some that work less hours. The future, however, it isn't all bleak, because at the same time, whilst we may see that continuing loss of senior nurses in the profession, junior nurses are coming through, graduate nurses are coming through, and part of what I'm hearing, which is encouraging, is that organizations are starting to cotton on that we need to invest significantly more in the career development of our graduate nurses. The ones that are coming through, we need to train them up, we need to give them proper skills, we need to nurture them. We can't be necessarily rude, and we need to be more tolerant tolerant if there are mistakes, because we need to look at people in these professions as, and I hate to say the word assets, but if we think about it from a nurturing perspective, then these are people that we need to nurture and grow, as opposed to use as a transactional relationship to fill a gap. And so in order to address that, we've got to be more tolerant of, as I said, mistakes. We've got to be more accepting of failure. These are realities on the ground on a day-to-day basis, because when you have more junior staff coming into the workforce without the support of senior staff, you may have those increase in critical incidents and so on occurring, and poorer patient experiences in some instances. And that's certainly anecdotally what I'm already hearing. And so over the last 6 months or so. And so we need to be more kind, we need to be more compassionate, and we need to actually, come at this from a nursing, from a caring perspective, and care for each other, not just nurses caring for nurses, but also across the whole team. Remember, medicine and healthcare is a team sport, and that it requires the collaboration between doctors, nurses, allied health staff, management, and staff, including the wonderful staff on the ward. It's a team sport, and so we need to support each other through this to get through some of the next 5 to 10 years as well. The mental health issues and the emotional demands are going to continue to be significant. Hopefully, I'm optimistic that there'll be more reform on ratios, and that there'll be certain ratios that will be required in aged care, community care, and so on. And how we deliver that is by investing more into the people and investing into the system, but also investing in improvement and smart strategies, not just blanket all-in-one strategies or policies that require everyone to do something to tick a box. I also think that, in addition, why I'm optimistic is that whilst these challenges are probably going to get worse in terms of shortages in certain areas, technology will help to some degree. And so more virtual care, telehealth opportunities, which are paid in the same hourly rates as those, if we can pay those nurses who are doing the tougher physical work more, that might incentivize people to stay in those jobs as well. Because at the moment, in some areas of nursing, we're paying the same if you do a telehealth consult as if you're doing a very heavy physical workload. And so we have these perverse incentives that are actually driving nurses out of the system when we want to try and keep them in. So these are some of the things that I think we're going to be challenged with over the next 5 years, but also how we need to counter some of those challenges as well. So we really need to think about how we're paying for people. And if we can't increase the pay, because in many cases and in many countries, there's certain award rates that are capped at the moment. And whilst we need to encourage governments to lift some of those caps, what organizations and hospitals and so on need to look at is how can we introduce value and better conditions for nurses, whether that's in terms of flexibility in taking leave, flexibility in the hours and shifts that they take on, flexibility in terms of, in some areas of nursing, working from home as opposed to having to come into working from the office or the ward or the hospital. We need to think about all these areas. I've just been in 2 conferences with organizations from multiple different industries, and they're all starting to, or have already introduced this work-life flexibility, from flexi time to flexi leave to flexi office versus home. We just need to be more flexible and cater to the needs and preferences of not just retired staff, but also the new workforce that's coming through, the millennials that are coming through that have different habits and preferences. And I was just advising a sort of a home care organization today, where they're treating everyone as one segment. That's not going to work. You've got to look at the different segments of your nursing staff, the different demographics, and make sure that your employee value proposition, and that is why would someone come and work to you, that you're able to do it appropriately for the different segments, because millennials may want different working conditions to those that are the seniors that are coming, that are in the workforce and are different, but we need to offer that a degree of flexibility for those. Ultimately, also, I think working in a safe environment is really, really important, and without the threat of violence from patients. So we need to have adequate security, we need to have adequate PPE in place for those sorts of things to ensure that that safety is there. One of the things that is also really important is, having nurse educators that can actually develop people's skills or nurses' skills whilst on the job. And so you have that career development pathway occurring. As I mentioned before, we all want to come and work in a place where you like the boss, where you like the team around you, and where you like coming into work. And even if, patients can be difficult on a particular day or a week, what gets you through it is that camaraderie with the people in your team. So I think we need to, over the next few years, 5 to 10 years, work on these soft skills of people management, team management, leadership, compassion, mindfulness, well-being, because whilst they may seem like soft skills and we can't put a hard dollar value against them, these are the things that help us retain our staff, keep the culture solid and healthy, and actually preserve our workforce for the future. So it's really important that strong leaders look at these factors and put in appropriate programs to keep people in the workforce with some of these techniques as well. So we think about what is the solution. Firstly, it's really important to really understand that there is no short-term fix here. One of the things that I'm seeing is that many leaders in organizations are unfortunately going, let's recruit our way out of this and let's make our value proposition as good as possible, and let's go to as many recruitment organizations as possible to recruit the staff that we need. And that's not solving the problem. You do need to really solve the problem and alleviate the problem in the organization to rethink how you retain staff. And part of what we are doing at Energesse is actually using an evidence-based approach, and that is by actually collecting the data, surveying staff, understanding what they need, or gathering the data from the internal systems to actually clarify what's actually causing people to leave in your organization, not just the macro factors, but specifically in a specific department, in a specific specialty, why are they leaving? And specifically, why are they staying? What are the reasons for that? It's called a driver analysis or root cause analysis. But part of that, linked together with the cost of the turnover, will help you build a business case on specifically what kinds of programs you need to put in place, and more importantly, monitor the value of those programs. Track them, monitor them, evaluate the cost benefit of every program that you put in place. Many organizations, in terms of looking at workforce from a strategic perspective, are not doing this well. It falls over, and in fact, the pandemic has probably elevated the need to do workforce planning, workforce strategy much more cohesively, much more strategically, and with better investment decisions made. So part of the tools that we're developing, and one of the tools that we're developing is a tool called PM-Me, which stands for People Matter to Me, is really taking that information where a lot of organizations are doing these People Matter surveys or staff engagement surveys. They're collecting the data on how their workforce are feeling, but they often don't know how to actually solve those specific issues, whether people are complaining about a manager they don't like, whether they're complaining about pay, whether they're complaining about workload. I often hear the rhetoric, oh, we already know this, but have you actioned it? Have you tracked and measured it? Have you assigned an accountable leader to improve on it? Have you removed the roadblocks for them and allocated appropriate resources? When you follow that workforce plan and the workforce strategy end to end, you'll find that end to end implementation is not done well. And this is what we see in a vast majority of cases. And so it's really important, if we are going to solve this, if you want to solve this within your organization, that you use an evidence-based approach where you collect some of this data and actually use the appropriate program for the appropriate problem. Otherwise, it's going to be implementing just short-term recruitment fixes alone will not solve the challenges in the organization. As I said, all these challenges are multifactorial. They can be due to workload, they can be due to work health and safety, they can be due to leadership, or it can be due to certain demographics. But unless you understand specifically what's going on, and specifically team or ward or so on, it's going to be really difficult. I think something like 40 to 60% of staff often leave an organization because they don't like their manager or their boss. But when we do exit interviews, I was interviewing an organization today, and that exit interview was being done by the manager of the boss, or the boss. And so truth doesn't come out that way. What we need to do is really get to the truth of the problem, because that's how you really create effective solutions that help solve it. In terms of the organizations that would benefit the most from our help, we've seen that in particular, there are hospitals, public and private, that have these issues. Aged care or residential care are also particularly have these acute shortages. And also we've seen that certain non-health organizations also requiring these. And these are the support services, such as the services that run the cafeterias, the back-end services that run laundry and cleaning and so on, that also have shift workers. These are large workforces that also work in the health and care space, but we don't often acknowledge them. So, and of course, the nursing cohort as well is where it's probably most acutely short, whether that's Australia, UK, America, or even Asia. These cohorts would benefit the most from some of the technologies and the data analytics and action solution suggestions that our tools are actually recommending to be used, because it allows a more evidence-based approach rather than pure gut feeling to solve some of these challenges. So I would strongly encourage organizations like these to get in touch, either contact me on LinkedIn. It's Avnesh, Avnesh, Ratnanesan, Ratnanesan. I like to spell it out because otherwise people try to Google Dr. Avi and they can't find me. Alternatively, contact us on the website. That's energesse.com, energesse.com.